Welcome. Today we delve into the intricate world of Alpers disease, a rare and devastating neurological disorder that primarily affects children. We'll explore its causes, how it impacts the body, and the current understanding of managing this complex condition. Prepare to learn about the challenges faced by individuals and families affected by Alpers disease. Alpers disease, also known as Alpers-Huttenlocher syndrome, is primarily caused by mutations in the PALG gene. This gene provides instructions for making the polymerase gamma enzyme, which is crucial for replicating and maintaining mitochondrial DNA. These mutations disrupt the enzyme's function, leading to errors in mitochondrial DNA replication. While most cases arise from inherited mutations, occurring when both parents carry a copy of the defective gene, spontaneous mutations can also occur, albeit rarely. The underlying problem in Alpers disease lies within the mitochondria, the powerhouses of our cells. Mutations in the PAL gene lead to dysfunctional polymerase gamma enzyme. This malfunctioning enzyme causes widespread mitochondrial dysfunction, especially in the brain and liver. The brain cells, particularly in the cerebral cortex and basal ganglia, become damaged due to energy deprivation, leading to progressive neurological decline. Similarly, the liver suffers from cell death and scarring, causing liver failure. The lack of healthy mitochondria disrupts essential cellular processes, resulting in a cascade of detrimental effects throughout the body. Alpers disease is a very rare disorder. Its exact prevalence is difficult to determine, but it is estimated to affect fewer than 1 on 100,000 individuals. The condition is observed worldwide, with no specific geographical predilection. Due to its genetic basis, Alpers disease can affect individuals of any ethnic background. It typically manifests in infancy or early childhood, although later onset cases have been reported. The signs and symptoms of Alpers disease are varied and progressive. They commonly include intractable seizures, meaning seizures that are difficult to control with medication. Developmental regression, characterized by a loss of previously acquired skills like speech and motor abilities, is another hallmark. Liver disease, ranging from mild abnormalities to severe liver failure, is often present. Other neurological symptoms may include muscle weakness, spasticity, vision loss, and cognitive decline. The presentation of symptoms can vary significantly between individuals. Diagnosing Alpers disease can be challenging due to its rarity and varied presentation. The diagnostic process typically involves a combination of clinical evaluation, neurological examination, and specialized testing. An EEG, or electroencephalogram, can help identify characteristic seizure patterns. MRI, or magnetic resonance imaging, of the brain can reveal abnormalities in brain structure. Blood tests can assess liver function and screen for metabolic disorders. Genetic testing to identify mutations in the PAL gene is essential for confirming the diagnosis. A liver biopsy may be performed to evaluate the extent of liver damage. While there are no official subtypes of Alpers disease, the age of onset and the prominence of specific symptoms can vary. Some individuals may present with primarily neurological symptoms, while others may experience significant liver involvement early in the disease course. The rate of disease progression can also differ among affected individuals. Currently, there is no cure for Alpers disease. Treatment focuses on managing symptoms and providing supportive care to improve quality of life. Anticonvulsant medications are used to control seizures, but they may not always be effective. Nutritional support is crucial to address feeding difficulties and prevent malnutrition. Physical therapy can help maintain muscle strength and prevent contractures. Liver transplantation may be considered in severe cases of liver failure, but it carries significant risks. Genetic counseling is essential for families affected by Alpers disease to understand the inheritance pattern and recurrence risks. Supportive care includes palliative care, hospice, and therapies to help with cognitive disabilities. As Alpers disease is primarily caused by genetic mutations, there are no known preventative measures to avoid the condition itself. However, genetic counseling is crucial for families with a history of Alpers disease or related mitochondrial disorders. Carrier testing can identify individuals who carry a copy of the mutated PAL gene. Prenatal testing options, such as amniocentesis or chorionic villus sampling, can determine if a fetus is affected by the disease. The prognosis for individuals with Alpers disease is generally poor. The disease is progressive, and most individuals experience significant neurological decline and liver failure. The average life expectancy is typically between 2 and 10 years after the onset of symptoms. Recent research is focused on developing gene therapies and other innovative treatments to target the underlying genetic defect in Alpers disease. Clinical trials are ongoing to evaluate the safety and efficacy of these novel therapies, offering hope for future improvements in the management of this devastating condition.